Fellow Singaporeans and residents, I'm speaking to you again to give you an update on the COVID-19 situation. We are now 2 weeks into the circuit breaker. On the whole, people have coped well. Most of us have played our part, staying at home, complying with the restrictions. We have adjusted to working from home and home-based learning. When outside, we wear masks and keep a safe distance from others. And we've kept to our immediate family units and avoided gatherings with extended family and friends. The number of new cases in the local community has leveled off to below 30 new cases daily. This is the result of the circuit breaker and all of us working together. But as you know, our total case numbers have risen sharply since the last time I spoke to you, just 10 days ago. Today alone, we have over 1,100 new cases. Almost all were detected in our migrant worker dormitories through aggressive testing. The large number of cases at the dorms is a serious problem. To assess the extent of the spread, we have tested aggressively, not only those who reported sick or showed fever or flu symptoms, but also those who were well and asymptomatic, not showing any symptoms at all. Almost all the migrant workers infected have, at most, only mild symptoms. This is not surprising, as they are generally young and thus much less likely to become seriously ill because of COVID-19. Our doctors, nurses, and healthcare personnel are working hard, triaging them early and taking good care of them. It is early days yet, but thankfully, so far, none of the new cases of migrant workers have needed supplemental oxygen or intensive care. We had one earlier case of a Bangladeshi worker who was in the ICU for 2 months. This was case number 42. We never gave up on him. Last week, his condition stabilized. He was transferred out of the ICU to a general ward. It will still take him some time to fully recover. With some luck, he should be able to see his newborn son soon. We hope that the situation in the dorms will remain this way, most of the cases being mild and very few needing oxygen or intensive care. All the major dorms are supported by dedicated teams of doctors and nurses. To protect the health of our migrant workers, we will step up the medical resources in the dorms. We will deploy more medical personnel to make sure that anyone with fever or flu symptoms receives appropriate and timely medical treatment. We will house the mild cases either on-site in a separate facility within the dorm or in community care facilities elsewhere. And we will make sure that those who need more active treatment receive immediate attention and can be sent promptly to the hospital to help them recover. We will also pay special attention to the older workers who are more vulnerable. We are preemptively moving them to a separate dorm where they can be monitored more closely. To our migrant workers, let me emphasize again, we will care for you just like we care for Singaporeans. We thank you for your cooperation during this difficult period. We will look after your health, your welfare, and your livelihood. We will work with your employers to make sure that you get paid and that you can send money home. And we will help you stay in touch with friends and family. Ramadan begins in a few days' time. We will make sure that arrangements are made for our Muslim workers. When Eid al-Fitr comes next month, we will celebrate with our Muslim friends, just as we celebrated the Indian New Year with our Indian first week. This is our duty and responsibility to you and to your families. Apart from the workers living in dorms, we are monitoring two other groups of migrant workers closely. First, workers who live in shop houses, private housing or HDB flats. And second, workers in essential services. This group is still working during the circuit breaker, helping to keep Singapore going. Some are cleaning the HDB blocks or hawker centers. Others are maintaining key infrastructure, like our broadband networks. If these workers move in and out of dorms, they become potential channels for cross-infection in both directions. Hence, we are housing these essential workers separately. We are also testing them to make sure that they are healthy and to pick up any infections early. So far, the clusters in the dorms have remained largely contained and have not spread to the wider community. We will do our utmost to keep it this way. In the wider community, the circuit breaker is starting to have an effect. The number of community cases has fallen in recent days. This is a result of all of us coming together, making sacrifices, and adhering to the circuit breaker rules. But we cannot afford to be complacent. We must press on to bring down daily infections more sharply to a single digit or even zero, and to reduce the number of unlinked cases. Those cases where we do not know how they got infected or from whom. Because, unfortunately, that number of unlinked cases has not come down. And this suggests that there is a larger hidden reservoir of COVID-19 cases in the community. And this reservoir is the source of these unlinked cases, which we have not detected. I discussed this with a multi-ministry task force on the next steps to take. We want to bring down the community numbers decisively. We also want to make sure that if any leakage occurs from the dorms to the wider community, we can detect it and contain it early and prevent new clusters from forming and bursting out of control. To achieve these two objectives, we must all hunker down and press on with our tight circuit breaker measures. We have called on all Singaporeans to stay home. Go out only for essential needs, like buying food or groceries. Otherwise, please stay at home. If you do need to go out, then go by yourself, not as a group or as a family. Even when exercising outside, do so only by yourself and only in your own neighborhood. Remember, it's not just about adhering to the letter of the law. The spirit of the guidelines is to reduce movement to a minimum and to avoid being out and about in the community. This is the way to protect yourself, your family, and everyone else. So I hope everyone can cooperate and do your part. Some hotspots, like some popular wet markets, are still a problem. Large groups of people continue to gather at these places, making it hard to practice safe distancing. These places will impose entry restrictions to thin out the crowds even more. You can do your part too. Do your marketing on weekdays rather than weekends. And don't bring your whole family with you for grocery shopping. When you run errands, go out alone, get what you need, and return home straight away. We will also close more workplaces so that only the most essential services will remain open. This will reduce further the number of workers keeping essential services going and minimize the risks of transmission among the workers. It will mean some degradation of services. For example, less frequent grass cutting in our HDB estates. But I hope we all understand why this has to be done. We will implement these tighter measures until the 4th of May. But we will not be able to completely lift the restrictions after that and go back to business as usual. We will therefore extend the circuit breaker for 4 more weeks beyond the 4th of May, in other words, until the 1st of June. Then, provided we have brought the community numbers down, we can make further adjustments and consider easing some measures. This way, we can be more assured that we've made definite progress and consolidated our position. Many will be disappointed by the extension of the circuit breaker, especially our businesses and workers who are hurting greatly. But I hope you understand that this short-term pain is to stamp out the virus, protect the health and safety of our loved ones, and allow us to revive our economy. The government will continue to help our businesses and workers cope during the extended circuit breaker period. We will provide the same level of support to workers and businesses as we are doing now. The ministers will hold a press conference immediately after this to explain the details. Saudara-saudari sekalian, sudah masuk 2 minggu kita menjalani langkah pemutus rantaian jangkitan COVID-19. Secara amnya, warga Singapura telah berjaya menyesuaikan diri sejauh ini. Sebahagian besar duduk di rumah dan mematuhi peraturan dengan bekerja dan belajar dari rumah. Dan tidak lagi menyertai keramaian dengan sanak saudara dan teman-teman. Juga memakai pelitup apabila keluar rumah. Saya tahu ini semua sukar, tetapi terdapat tanda-tanda yang menunjukkan bahawa kita telah mencatat kemajuan. Di kalangan penduduk Singapura amnya, jumlah kes merosot ke paras kurang 30 kes sehari. Namun, jumlah kes baru yang melibatkan pekerja asing di dormitori terus meningkat dengan tinggi. Ini adalah satu masalah yang serius. Kami telah melancarkan usaha besar-besaran untuk membendung situasi di sana. Mujur, hampir semua yang dijangkiti menunjukkan tanda-tanda jangkitan yang ringan. Kami akan melipat gandakan usaha untuk membantu pekerja asing. Ini termasuk menubuhkan lebih banyak pusat perubatan dan mengerahkan lebih ramai doktor dan pegawai kesihatan untuk menjaga mereka. Kami harus menjaga pekerja asing seperti mana kami menjaga warga Singapura. Kami akan menjaga kesihatan dan mata pencarian mereka. Ini adalah tanggungjawab dan kewajipan kami kepada pekerja asing dan keluarga mereka. Di kalangan penduduk yang lebih luas, yang membimbangkan ialah ada banyak kes-kes yang sumbernya tidak diketahui. Ini bermakna ada jumlah kes yang besar dalam kalangan penduduk yang belum dikesan dan merupakan sumber kes-kes yang tidak berkait. Saya telah berbincang dengan menteri-menteri tentang strategi selanjutnya. Kami sepakat untuk menurunkan jumlah kes dengan tegas supaya kami dapat melonggarkan langkah-langkah pemutus rantaian jangkitan dengan secepat mungkin. Kami juga mahu memastikan bahawa sebarang penularan jangkitan di luar kelompok pekerja asing boleh segera dikesan dan dikaya tidak menular menjadi kelompok baru. Demi mencapai dua matlamat ini, kami perlu memperketatkan langkah-langkah pemutus rantaian jangkitan. Ini akan dilakukan sehingga 4 hari bulan Mei. Ayuh, kita kuatkan azam sepanjang 2 minggu ini supaya memutuskan rantaian jangkitan COVID-19. Jika semua berjalan lancar, kami boleh melonggarkan langkah-langkah ini kemudian. Bagaimanapun, kami tidak boleh menamatkan sepenuhnya pada 4 Mei. Kami terpaksa melanjutkan pemutus rantaian jangkitan 4 minggu lagi sehingga 1 hari bulan Jun. Dengan ini, kita boleh jangkakan kemajuan yang lebih mantap dan baik. Pemerintah akan terus membantu golongan pekerja dan pemilik perniagaan dalam tempoh lanjutan ini. Saya harap anda semua dapat berikan kerjasama penuh anda. Bagi masyarakat Melayu Islam, anda akan menyambut bulan Ramadan minggu ini. Dengan masjid-masjid masih ditutup, Ramadan kali ini tentunya berbeza dari tahun-tahun sudah. Nampaknya, saya tak ada peluang untuk buka puasa bersama anda di masjid. Sayang sekali. Tetapi, saya difahamkan, MUIS, para asatiza dan masyarakat Islam kita penuh semangat untuk pastikan Ramadan tahun ini tidak kurang hebat dan bermakna. Banyak wadah dan bahan-bahan online disediakan untuk membimbing masyarakat Islam menjalankan ibadah puasa, membayar zakat dan juga membuat amal jariah, menolong mereka yang memerlukan. Banyak keluarga juga semakin mahir menggunakan teknologi untuk terus berhubungan dengan sanak saudara dan teman-teman. Syabas. Saya sangat menghargai pengorbanan dan daya tahan anda untuk mengharungi masa-masa sukar ini. Saya dan pasukan saya sedang berusaha memastikan setiap penduduk Singapura selamat. Inilah tugas paling penting kami. Kami tidak akan berhenti selagi matlamat ini tercapai. Bersama-sama, kita boleh mengatasi wabak ini. Terima kasih. 各位同胞，今天我想再次和各位说明冠状病毒疾病在新加坡的传播趋势，以及接下来我们必须采取的一些措施。我们是大约在2个星期前实行阻断措施，大致上国人都相当合作，留在家里，在家办公上课，也暂时没有跟其他家人和朋友聚会。这是不容易的，不过大部分的国人都为了大家的安全做出不同的牺牲和调整。目前每天平均出现20到30起新的社区感染病例，这显示阻断措施已经取得一点成效。谢谢大家的合作。如今冠状病毒主要是在科工宿舍传播。政府非常关注科工宿舍的疫情，积极采取行动遏制病毒的扩散，确保科工得到妥善的医疗照顾。我很欣慰，许多社会团体和爱心人士都伸出援手，筹集善款， 和物资给我们的客工朋友，帮助他们度过这个非常时期。另一个我们需要关注的情况是，社区感染病例中还有不少患者与其他病例没有关联，我们不知道他们如何受到感染，或是和谁接触了。也就是说，我们的社区里可能存在许多还没有被发现或检测出的病例，这令人担忧。因此，我和政府跨部门工作小组进行了讨论，我国接下来应该怎么做？我们只有2个目的：第一是让社区感染病例大幅度减少；第二是确保客工宿舍疫情受到控制，以及没有扩散到社区。为了达到这些目的，我们做了2个重要的决定。第一，我们将进一步收紧现有的阻断措施，一直到5月4号。我们将继续要求国人留在家里，除非需要处理必要的事情，例如购买食物或必需品，否则请不要出门。如果不得不出门，请戴口罩。同时，每个家庭在任何时候最多只能有1个人外出。我们也将加强人流管控措施，限制人潮较多的地方，如一些巴士的人流量，让人们能够保持安全距离。同时，政府会暂时关闭更多工作场所，以减少员工之间的接触。只有提供最关键必要服务的商店、超市和工厂等能够继续营业。工作小组将在接下来的记者会上公布更多详情。我们希望这些新措施有助于大大减少社区内的传染。可是从目前的疫情来看，我们应该无法在5月4号达成之前预定的目标，完全解除阻断措施。因此，我们做的第2个决定是将阻断措施实行期延长4个星期，直到6月1号，以保障国人的安全。当然，政府明白这会对企业和员工带来一定的影响，所以之前所公布的援助措施也将延长。我们将竭尽全力与企业和员工一起度过这个难关。我要再次吁请国人继续与政府合作，特别是年长人士，你们的抵抗力较弱，其实我们的抵抗力较弱，请别出门，也别到处乱跑，要留在家，才能避免受到感染。有人说自己生病是自己的事，可是如果你生病了，把病毒传染给别人，那就是大家的事了。所以，请大家不要轻视这个病毒，认真对待以及遵守所有防疫措施，让我们都负起社会责任，保护自己，也保护家人。Let me conclude in English. You will naturally ask, where does this lead us? How do we exit from the circuit breaker? Nobody knows how long the pandemic will last. Most likely, it will take more than a year before effective treatments and vaccines become available. So we have to take things one step at a time. To exit from the circuit breaker, we need to do 3 things. First, we must open up incrementally, in small steps, making sure that we are safe each step of the way. This is what New Zealand and Germany are beginning to do, very cautiously. They believe that they have broken the chain of transmission, but they want to be extra careful. They don't want to open up prematurely after lockdowns only to find COVID-19 coming back and then be forced to lock down a second time. This has happened in Hokkaido. We should try our best to avoid this. Second, we need to scale up testing for COVID-19 substantially so that we can quickly detect any new cases that pop up. This we are progressively doing, not only by procuring test kits and equipment from other countries, but also by developing and manufacturing our own test kits. Third, we will need to make full use of information technology, IT, so that when we discover COVID-19 cases, we can trace much more efficiently where they have been and whom they have been in contact with. We have the Trace Together app, and we are currently developing other apps for this purpose. For these apps to work, we will need everyone's cooperation to install and use them, like what the South Koreans have done. There will be some privacy concerns, but we will have to weigh these against the benefits of being able to exit from the circuit breaker and stay open safely. I know this has not been an easy time for everyone. We are making progress, but we have not yet succeeded by a long way. The results do show that the circuit breaker is working. Now, we all need to do a little bit more. Make best use of the next 2 weeks of the tightened circuit breaker and the 4 weeks of the extension beyond that. I ask for your support and cooperation. I ask for your trust and confidence. Let us go all out to beat the virus and break the chain of transmission. We will overcome this together. Thank you.
Good evening. This is a virtual conference, and we are seated a distance apart. And that's why we are not wearing masks, so that you can hear us better. The COVID-19 pandemic has continued to evolve rapidly. Scientists and doctors are continually discovering new things about the virus, its transmission, treatment, and immunity. The public health response has to adapt. Like many countries around the world, Singapore has implemented strong measures to slow the spread of the virus, including the circuit breaker that we are living under now. But the number of new cases has risen sharply, due largely to clusters in our migrant worker dormitories. PM has just emphasized how we are looking after our migrant workers. There are signs that our measures are working in the wider community, but the numbers, especially unlinked cases, have not come down enough. We are concerned about undetected cases in the community causing further infections. This is why PM has just announced a further tightening of measures for 2 weeks and an extension of the circuit breaker by 4 weeks until the 1st of June. The multi-ministry task force will share more details. Kim Yong will update on the overall situation and our strategy to deal with this phase of our fight against COVID-19, and Director of Medical Services, Kenneth Mark, will cover the medical aspects. Lawrence will give the details on the further tightening of measures and the lengthening of the circuit breaker, and Josephine will provide an update on the situation in our migrant worker dormitories. I'll now hand over the mic to Kim Yong.
Thanks, DPM. As of 12 p.m. today, there are an additional 1,111 COVID-19 cases in Singapore, of whom 20 are Singaporeans and permanent residents. We have seen a significant increase in cases in the past 2 weeks, driven predominantly by aggressive testing in the foreign workers' dormitories. While we are addressing the cases in the dormitories, we are also monitoring closely the number of new cases in the community. The circuit breaker measures appear to have helped. The number of new cases in the community has decreased from an average of 39 cases per day in the week before to an average of 29 per day in the past week. That said, the number of cases in the community remains a worry for us. What is particularly concerning is that the number of unlinked cases in the community has not fallen, averaging about 20 cases a day. We have also been picking up COVID-19 cases from our surveillance programs. This indicates that there is continued seeding in the community. Many of them undetected because the illnesses are mild, the symptoms are mild, but they are still infectious. We are now at the midpoint of the circuit breaker measures. It is therefore very critical for all of us to put in extra efforts in safe distancing so that we can break the transmission and further reduce the number of cases in the community. We will also extend the circuit breaker period by another 4 weeks until 1st of June 2020 to give more time for the circuit breaker measures to take effect on the ground and to ensure we stamp out the transmission. Lawrence will give further details on some of these measures. On patient care, our key focus is to ensure patients receive appropriate care. We must pay particular attention to the more vulnerable patients, for example, our seniors, the older workers, and we must also do what we can to avoid fatality at all possible. Patients who are more severely ill will continue to be treated in our acute hospitals. Those who are clinically well may be cared for at our community care facilities. And I want to take this opportunity to thank all our frontline workers, especially our healthcare workers, who have come forward to work very hard and to care for our patients. And I also want to thank all our partners who have stepped up and partner us and offer their assistance in many of our initiatives and programs. I want to take this opportunity to also thank fellow Singaporeans for doing their part in practicing safe distancing. We know Singaporeans have been looking forward to resuming their normal activities, but we need to push on for the safety of everyone, especially the more vulnerable in our society. Let us stay the course and overcome this crisis as one people. Now I'll ask DMS to give an update on the medical situation.
Thank you very much, Minister. As of the 21st of April 2020, the Ministry of Health has confirmed an additional 1,111 cases of COVID-19 infection in Singapore. As Minister said, 20 of them are Singapore residents, Singapore citizens or permanent residents. And we are still confirming the count. At this point in time, provisionally 1,046 work pass holders who are residing in our dormitories. A more detailed breakdown will be provided in the press statement later today. We continue to see a trend where the number of imported cases has come down very significantly. On most days, that has been 0 since the 10th of April. Of the confirmed cases that we have, and in total we have 9,125 cases. We have discharged 39 patients today, and 27 patients are in the ICU. We continue to look after them to the best of our abilities. The remaining patients are looked after in a variety of different settings, and that includes those who are in our acute hospitals, those who are nursed and looked after within our community care facilities, as well as in isolation facilities that we have designated and set up within dormitories. We have a small number of patients who are currently within private hospitals, and they are recovering while awaiting confirmatory tests before we deem them suitable and fit to return to the community. Efforts remain to provide further support for all our foreign workers in the dormitories. We've set up medical teams and medical posts that provide support for all our 43 purpose-built dormitories. We are also arranging for a system of medical support that would provide augmented cover for workers who are also accommodated in other settings, including factory-converted dormitories. This has been with the strong support of our regional health systems. And I wish to acknowledge also the contributions of volunteers who have stepped forward under our SG Healthcare Core initiative. Many of them have come from a variety of different settings, including from the private sector, and they work hand in hand with our staff in the public healthcare institutions in the front line, supporting the medical, giving medical treatment to factory workers in dormitories. We also have a strong partnership with the Singapore Armed Forces, who have stepped forward to provide us with invaluable support in many different areas, including contact tracing, in the management of quarantine operations, in helping us to establish and set up many of the medical posts that we have, in helping us to establish swab and isolation facilities that support the work of the dormitory medical system, as well as providing strong leadership within the dormitories, working very closely under the auspices of the Joint Task Force with the dormitory operators to ensure that there is a proper system in place for isolation and segregation. And we remain committed to make sure that we provide the best support we can, treating all our foreign workers and making sure that they receive good care. We will continue to establish more capacity in our community care facilities to accommodate the foreign workers who are infected and who present to us. And we remain committed to making sure that our entire healthcare system can respond flexibly to accommodate the increase in needs on the ground. Thank you.
Good afternoon. As we all know, we are midway through the circuit breaker. We are already seeing some positive results, but we cannot be complacent, and this is the time now to continue to hunker down and give this a further push. So first, we call on everyone to do their part to minimize movement. Remember, the virus spreads through people, through our contacts with others, and when we go out and touch surfaces, and then our hands touch our faces. Yes, we can take precautions like safe distancing and wearing of masks, but the best way to beat the virus is to stay home. So if you need to go out to buy food, to buy groceries, go out alone. Don't turn this into an occasion for a family outing. And if you need to go out to exercise, exercise alone and in your own neighborhood. Don't travel out to exercise. So we call on everyone to do this because it is the best way to protect yourselves and your family members. Second, we will continue with our efforts to control people movement in popular areas like wet markets and supermarkets. In these areas, we will impose entry restrictions. For example, in certain wet markets, we will only permit entry on alternate days. And we will do this with a system based on your NRIC or your FIN number. Depending on the last digit of that NRIC or FIN number, you will only be permitted entry on odd or even days. So that's one example of a localized entry restriction that we will start with wet markets, and we will do this also in other popular areas like supermarkets in order to thin out the crowds and reduce transmission risk in these areas. Third, we will close more workplaces and also tighten the list of essential services that are permitted. I mentioned this last week, and we are now ready to make this move. This is important because when we analyzed the local infected cases that occurred after the circuit breaker, many of them have been working as part of essential services or have family members who are working, because these are the people who are still out and about. We do need our essential workers. We appreciate their contributions, but we have to reduce the numbers who are working. And that's why we'll make a move to cut back the workforce who still have to commute daily from the current 20% to 15%. And we will do this by making cuts across all sectors of the economy, but also in businesses that are consumer-facing, including in F&B and other services. So this will mean that all of us may face some degradation of services, or we may not be able to access F&B or certain services that we have become accustomed to. And I hope everyone understands why we need to make this important move. So overall, we are seeing results from the circuit breaker, but we cannot let up now. We have to make this strong push to decisively break the transmission chain. The measures that we've just announced will be in place till the 4th of May. Beyond that, we will continue with the circuit breaker for another 4 weeks to 1st of June. Depending on how the situation evolves, we will adjust the measures, and if there are clear improvements in our community transmission numbers, for example, if we see community numbers coming down to single digits, then we can consider gradually easing some of these measures. We've said from the outset that this is a prolonged fight, and we thank all Singaporeans and all residents of Singapore who have risen to the occasion and done their part through this circuit breaker period. Let us all continue to go all out to stamp out the virus and overcome this together. Let me just say a few words in Mandarin. 病毒阻断措施实行至今已经2个星期，我们已经开始看到一些成效。我们需要继续努力，再加一把劲。首先，大家必须在减少活动，留在家里，因为这是阻断病毒传播的最佳办法。如果你需要购买食物或日常用品，自己一个人出门就好。不需要用全家一起出去。如果你需要运动，也自己一个人就好，而且应该在自己居住的邻里范围运动。我们将会继续针对多人聚集的地方进行管制，像是斯巴萨和超级市场，这些地方将会有人流管制。如果你需要上巴萨和超级市场，最好是选星期1到星期5，人比较少的时候。另外，我们也进一步减少必要服务的种类，继续减少出门工作的人数。我们非常感谢必要服务领域员工在这段期间的贡献。我们将确保继续开工的员工保持安全距离，以及采取必要的防范措施。我们虽然开始看到成效，但绝对不能松懈下来，所以我们决定延长病毒阻断措施直到6月1号。我们将会持续观察情况，按照事态的发展调整措施。如果病毒传播的情况有明显的好转，我们会考虑放宽某些措施。要成功对抗病毒，除了站在前线的医护人员，也需要你我的努力。我们希望大家都能遵守阻断措施，让我们早日打赢这场仗。谢谢。
Good evening. I'd first like to provide an update of the situation in the dormitories. Previously, at the last virtual conference, I had sketched out our overall dormitory landscape, as well as the three-pronged strategies and the 3 key enablers for us to effectively implement the strategies. One of the key enablers are the forward assurance support teams, FAST teams. FAST teams have been deployed to all 43 purpose-built dormitories, and we have further raised another 26 teams to also look after the factory-converted dormitories. The medical posts have been up and running in all 43 purpose-built dormitories. In addition, we have also assembled mobile medical teams to support the factory-converted dormitories. And all in all, about 10,000 essential workers have been transferred out of these dormitories and have been relocated. They are now staying separately. Throughout this period, we have gotten the very strong support of the migrant workers themselves living in the dormitories. They understand the need for these measures and they have cooperated, for which we are very thankful for. Here, I also want to acknowledge the contributions of many non-governmental organizations who have stepped forward to volunteer their services and partner with the Joint Task Force in reaching out to the migrant workers and to support them during this difficult period. One area which has been particularly helpful is providing emotional support through assembling a team of counselors that are available to discuss with the workers any issues that they might raise. Now, because of the scale of the operations, this remains a very challenging task. However, we will press on, focusing on the workers' well-being. Now I would like to talk about some further measures that we will take in the dormitories. Prime Minister Lee earlier had talked about the situation when workers continue to move in and out of the dormitories. And when they do so, there are potential channels for cross-infections in both directions. We have completed the pull-out of the essential workers and housed them separately. And so we will now require all the workers staying in all the dormitories to stop going to work. This was something that we had planned for, and now we are going to implement it. Now, this new condition applies to workers from all companies, including those that have earlier obtained exemption to operate, but which MTI will now notify to suspend operations for this period. We know that there are going to be some adjustments to be made by the companies, but we seek the cooperation of both the employers and the workers on this new condition. It is a necessary measure to minimize the risk of transmissions. I also want to add that with Ramadan around the corner, the Interagency Task Force has coordinated with caterers and the purpose-built dorm operators to provide timely pre-dawn and breakfast meals. This is very important to our Muslim friends, and we want to make sure that they're properly taken care of when Ramadan begins. The task force has also translated MUIS Ramadan Guide 2020 on religious observances to take into account the safe distancing measures. And this will provide guidance to the dorm operators on how to facilitate Ramadan religious practices. MUIS has also come in to develop videos for religious guidance tailored to the workers' needs. We're very thankful to MUIS for this very important partnership. The third part I want to cover is on the stay-home notices for workers in the construction sector. We decided to do this because contact tracing efforts suggest that the transmissions at common construction work sites may have contributed to the increase in the numbers of infected workers. So this is something that we have taken as an added precautions, and during the period of the stay-home notice, enforcement officers will conduct regular and random checks. They may make phone calls or send SMS messages to the affected workers and require the workers to respond to these messages or phone calls. We hope that the workers will respond in good time so that we can also check on their well-being, whether they are getting the support that they need, whether it is for food or for other items, particularly on healthcare. Now, because of the circuit breaker measures already in place, frankly, we are seeing very good cooperation from the workers that are affected by the stay-home notice as well as their employers. We're very thankful to them for understanding the need to implement this precautionary measure in a very quick fashion and for making the necessary adjustments. I think if we were to be able to follow through with this, work stoppages, together with the closure of shopping areas, socializing areas, and coupled with the measures taken at the dormitories, we have a real chance of breaking these channels of transmission and a real chance of overcoming this hump in order that we may slowly bring back the recovery measures. That's all I have today. Thank you.
Thank you, Josephine. Now, let me elaborate on how the government will help our businesses and workers cope with the extended circuit breaker period. We understand that the enhanced measures and circuit breaker extension will have a significant impact on businesses. To support our companies and workers, we will extend key support measures in the solidarity budget into the month of May. I will extend the 75% wage subsidy under the Jobs Support Scheme to all sectors for the month of May. I urge our business leaders to do your best to retain your workers and make full use of the various grants for training and other schemes for upgrading corporate capabilities. I will further enhance the Job Support Scheme to include certain groups of shareholder directors. These are employees of a company who are also shareholders and directors and who missed out on both the Job Support Scheme and the Self-Employed Income Relief Schemes. I will also waive the foreign worker levy due in May and provide employers with another $750 in foreign workers levy rebates for every foreign worker in employment. Families whose breadwinners have lost their jobs can apply for the COVID-19 support grant from 1st May 2020 and the Temporary Relief Fund. The extension of the solidarity budget will cost $3.8 billion. To conclude, in the months of April and May, this will be a test of our resilience as individuals and as a society. We cannot be certain when the crisis will end, but what is certain is that we are here for you and we will support you. Our healthcare essential workers are central to our response to COVID-19, but the rest of us can do our part by staying at home, by encouraging those on the front line, and by helping the vulnerable and those around you. This is the spirit of Singapore Together. The coming weeks will be even more critical. I urge everyone to keep up this spirit of unity, resilience, and solidarity. As long as we stand with one another, we will emerge from this crisis stronger. Let me now say a few words in Mandarin. 总理刚宣布，阻断措施实行期将延长4个星期，这会带给企业和员工很大的压力。为了保工作、保企业，我们之前给予企业和员工的援助也将延长1个月。我们将在5月份把雇佣补贴计划的薪金补贴比例维持在75%。这将同样涵盖所有行业。我们还会扩大雇佣补贴计划的范围，涵盖一些符合条件并担任公司董事和拥有公司股权的职员。为帮助聘请客工的企业应付人力成本，我们将豁免多1个月的外劳税，同时继续提供额外的外劳税回扣。从2020年5月1日起，失业国人也可以申请冠状疫情薪金补贴，每月获得800元的补贴，为期3个月。这是非常时期， 全民居家防疫考验了国人的毅力和社会的韧性。每位国人现在都站在抗疫的前线上，我们要做好本分，不要慌，不出门，不乱传，为病疫尽一份力。这样一来，我们才能同舟共济，保健康、保工作、保企业。谢谢大家。
Thank
We're
you,
now-
panelists. Thank you, panelists. We will now begin with the Q&A. Media agencies, please use the raise hand button if you would like to ask a question. May we have the first question from Timothy from Straits Times?
Hi, thank you, ministers, DPM. I'd like to ask, foreign workers are being tested very extensively here. So why is this not being done in the community? And would many more cases surface as a result? Do we not have enough tests and reagents in order to do this? And also, given that we are now seeing increasingly tightened movement control measures, possibly even at wet markets, supermarkets, are there any circumstances under which ordinary people, those not under stay-home notice or quarantine, will not be allowed to leave their homes at all, even to buy groceries or food? This is because, every time there's this announcement, we see big numbers of people flocking to the supermarket to panic buy.
Sorry, can you repeat the last part of your question about?
Sure. So this is because every time we see an announcement about new measures, we always see large numbers of people flocking to the supermarket to stock up because they're afraid they won't be allowed out. So could we get some reassurance that people will be allowed out no matter what?
Okay.
Thank you.
We're allowed to go out.
We will continue to to conduct tests and screening for Singaporeans and for our foreign workers, but we do it in a very strategic way, focusing on the objective of the test. In the dormitory, for example, in the cases where we have a higher level of prevalence, we want to test them in the first instance to give us a better understanding of the general level of prevalence in the dormitory so that we are able to establish the baseline, what is the prevalence level in dormitories. And from our general surveillance, we also have been able to identify dormitories which have higher prevalence and dormitories which have lower prevalence. And some dormitories actually do not have any case at all for the time being. And therefore, our approach, our strategy in dealing with different dormitories of different prevalence levels will also be different. So therefore, it allows us to determine what approach we should take with respect to the different dormitories based on the prevalence levels in these dormitories. And we also use these tests to identify positive patients so that we are able to provide the necessary medical attention for them. Whereas in the community, because every Singaporean is in a community, we have millions of Singaporeans, we will not be able to test every one of them. So even in the community, we do targeted testing. For those who are continuing to work, for example, we also will test them to make sure that they are not infected while they are going to work. But of course, we will not be able to test them every day. And therefore, we do targeted testing as well, especially when they are being brought out, the essential workers, they are being brought out from the dormitories and separately accommodated, like Minister Josephine mentioned just now. We test them to make sure that they are not infected, and we will continue to test them regularly because while they're in the community, there's always a risk for them to be infected. But for the general population, I think the best strategy is really to stay at home. If you are able to stay at home, minimize the contact, minimize exposure in the community, then the risk will be significantly lower for getting the infection. And therefore, if your risk is significantly lower, then the testing will not be meaningful or effective. So I think that therefore, we need to make sure that our testing is always very targeted, very strategic, and serves a specific purpose. And at the same time, we are also continuing to ramp up our testing capability and capacity so that we are able to be more effective in detecting cases. And in addition to the these COVID-19 testing screening programs, we also have a surveillance program, what we call Sentinel Surveillance, as I mentioned in my opening remarks. These are surveillance programs that we do random testing in the community. The idea is to pick up cases that would otherwise have not been detected because they are either mild or they don't complain about possible COVID-19 and they do not have case histories, and therefore, but we still test them, and we have been able to pick up a few cases, and these also reflect the fact that there are underlying cases they are transmitting in the community. And that is why we need to put in extra efforts in these circuit breaker measures to make sure that we are able to bring down these community cases, particularly those that are unlinked. This way, we will overall generally reduce the risk of transmission in the community.
Can I just respond to the question on
community cases, particularly those that are unlinked. This way, we will overall generally reduce the risk of transmission in the community.
Can I just respond to the question on whether or not people can go out? And just to be very clear, we are mindful that some people do have difficulties being isolated at home and being cooped up at home for long periods. It is genuinely difficult. It can lead to social, emotional difficulties, and which can all impact on people's well-being and health. And that's why we do allow people to go out for essential activities. What we are saying is when you go out alone, do what you need to do, run your errands, buy your food and groceries, and then come back as soon as possible. Minimize movement as far as possible and avoid going out as a family, even if you are living together, right? Because if you go out in groups as a family, you end up with more movement, more likelihood of transmission, more risk. So overall, the best thing to do, go out individually and keep the movement to a minimum. The restrictions that we are putting in place at wet markets and supermarkets, it's not going to be done across the board. In fact, already under the circuit breaker, you do see that many of these places, the crowds have thinned out, right? So, but there are still a few supermarkets and wet markets which tend to be more popular, and these are the ones, particularly at certain times of the week or certain days of the week, they do tend to be more popular, and so we do need to pay more attention to these areas. And that's why in some of these more popular areas, we will impose the entry restrictions that I mentioned.
Thank you, ministers. Can we have the next question from Cheryl from CNA, please?
Yes, so Mrs. Teo, you earlier mentioned that you've seen more cases of transmission at the construction sites. Could that be the source of the surge in numbers at the dorms? Have we been able to, isolate that as a reason for the explosion in the dorms? And when can we expect a peak in numbers from the dorms? Secondly, also for the
Cheryl.
McDonald's case.
Thank you, Cheryl. Now, the epidemiological findings does provide us with some preliminary clues. We are very keen to understand how the transmissions amongst our migrant workers came about, because we really do want to stamp out the transmissions, and this will be important going forward as well. Now, if you recall, from January to the middle of March, the cases of infected migrant workers were few and far between. And then sometime in the middle of March, they started popping up around the same time in some dormitories, not in all dormitories. The contact tracing does suggest that the migrant workers, although they lived in different dormitories, they had common work sites. And if you look at the pattern of their socializing during the rest days, there are certain areas that they frequented. And these were also the same places that they went shopping. So the measures that we are taking at the dormitories today have to be taken together with work stoppages, as well as the closure of shopping areas. We think that the areas where the transmissions can occur actually can amplify the effect on each other. Because if you go to work at the same work site, but at the end of the workday, you go back to different dormitories, and if a transmission had occurred at the work site, then in fact, it wasn't just where the original infected workers were staying, it will be to other dormitories where the transmission had previously not occurred. Now you can extend this to also include the places where our migrant workers are very likely to socialize. It is part of human nature to socialize, and there's nothing wrong with socializing. But every activity that brings people together is also an opportunity for the virus to spread. And that is what we are learning about the virus. It spreads very easily through all kinds of human contact. And whether it is the workplace or places where we live or places where we socialize, these are all areas where transmission can occur. And if we really want to break the chain of transmissions, we've got to intervene at all of these places.
Thank you, Minister. Can we have the next question from Stefania from Financial Times, please?
Hello, thank you very much. I had a bit of a general question about the trend for coronavirus in Singapore. Obviously, we've seen an enormous jump just in the last 2 weeks from about 1,500 now to more than 9,000. It's a vastly different situation compared to the initial stage of the outbreak here in Singapore. So could the panel respond to the question, what has gone wrong in the last few weeks? And for example, in the foreign worker dormitories case, which obviously is driving a lot of the numbers at the moment, did authorities not start moving out the foreign workers out of the dorms earlier because it would have been hard for you to justify such a large-scale operation with potentially very high costs, with there being no outbreak in dorms, sort of doing that level of operation before seeing a big jump in numbers? Would it have been difficult essentially to justify doing so because of the high cost of such an undertaking?
Yeah, thank you. I think it's important to understand the rise in numbers, particularly coming up from the migrant worker dormitories, are not new cases of infections. As we have highlighted, the teams are in the dormitories testing workers, not just workers who have reported sick or have symptoms, but even workers who are well and with no symptoms. They are already enforcing safe distancing. They are separated from one another, not intermingling. But when we go in to do an active sweep of the dorms, testing them, we are finding that many of them, even without reporting sick, in fact, have been infected with the virus. And that's the reason why with this aggressive testing regime that we are doing to determine the extent of infection in the dormitories, that's why you see high numbers popping up every day, because it's a very aggressive sweep of the workers inside the dorms, even when they are not sick, even when they have no symptoms. What this suggests is that, in fact, the infections have been occurring for some time, starting very early, and it has been going on and circulating. Otherwise, you would not have been able to pick up such high numbers. So this is what we are doing now, going into the dormitories. We have a strategy to test the workers, to separate the ones who are infected from the ones who are healthy, and to ensure the well-being of each and every migrant worker in the dormitories and outside the dormitories. We have a strategy for that. That's one strategy, but as I've said before, we are tackling the virus on two fronts: the migrant worker front, and also the rest of the community, the rest of the general population. And there, if you look at the efforts, as I've said, we are seeing results. We are seeing the numbers of community transmission coming down, and that's why we want to go all out to bring the numbers down further, preferably to single digits, and then we can manage well on both fronts to take care of Singaporeans as well as migrant workers and to tackle the virus situation holistically as a nation.
Can I just add a point, if you, excuse me? It's not just a question of cost, and I think it's an important point to make. This is not just about cost. If you look at the measures that were taken at the dormitories from the beginning of January, we reached out to the dormitory operators and asked them to raise the hygiene standards. Then we also produced lots and lots of materials to encourage the workers to protect themselves by arming them with knowledge of what to do in the face of this virus outbreak. Then we subsequently also implemented distancing measures within the dormitories, closing some of the non-essential facilities like TV rooms. But if you look at the measures that we are taking today, it has gone well beyond that. We are now asking the workers not to go to work. So from the workers' standpoint, this is a question of livelihood. Now, to say that we could have done this much earlier, I think really does not reflect an understanding of the workers' own concern. It would not have been so easy to tell the workers, please don't go to work, because we want to protect you. You have to do this in the context of a circuit breaker where all work mostly have come to a stop. We would have had to ask the workers not to cook for themselves, prepare the meals that they like at the end of the day in order for them not to use the communal kitchens and interact with each other. We would have had to ask the workers, please don't go out on your rest days. Please stay in your rooms. Please don't interact with your friends. So it's not just a question of cost. It is also a question of what is necessary to break the transmission. And it is important for us to recognize this and not frame this really from a cost viewpoint and and as a result conclude that we didn't undertake these measures earlier only because of cost. It is not that at all. It is that to break the transmission, you really need a whole host of other things to happen. Work stoppages, closing shopping areas, preventing people from socializing from one another. It goes well beyond cost.
To add to what Josephine has just said, our priority has always been very clear right from the beginning, which is to protect our people in Singapore, whether they are Singaporeans or foreign workers or migrant workers here. And we expect that the measures that we take will affect our businesses, will affect our economy, will have costs. But we are prepared for that. And that is why we had 3 budget measures, and today I'm just announcing another set of support for our businesses and workers. Also, I started this conference by saying that the COVID-19 pandemic has continued to evolve rapidly, not just in Singapore, but all over the world. And scientists and doctors are continually discovering new things about the virus, its mode of transmission, its treatment, and the immunity. So let me ask our Director of Medical Services, Kenneth, to add a few words on this.
Indeed, DPM, we've learned a lot more, particularly over the last month or two, in terms of how the virus spreads very easily and very, very fast. While the mode of transmission still remains the same in terms of our understanding, we've come to realize that many individuals who are infected, in fact, are very infectious, particularly in the first few days after being infected. Because they're shedding the virus very early at a stage when they are just having minimal symptoms or even asymptomatic, it leads to a high risk of spread occurring very fast, particularly in settings where there's a lot of communal activity. People are coming together. We've seen this in the cluster associated with Safra Jurong, where people are coming together in close proximity for group singing activities. We're seeing this now even in the dormitories, when people are coming together for communal eating, sharing things together. Even in the workplace, the workers, in fact, are very close together. So that close proximity, that activity is lending itself to rapid spread of infection, particularly in these settings. And it's therefore very important for us to appreciate this and to minimize our contact, particularly when we engage in activities that increases that risk of exposure for us. We've always talked about the need to respect personal hygiene, washing our hands. Now we've also been telling you about practicing safe distancing. We think these are all relevant. But in fact, in order to disrupt this chain of transmission, particularly in the settings where spread can occur so quickly, it's in fact important now for us also to emphasize not to go out, minimizing unnecessary activities, and even in settings where we are with others, practicing that safe distancing is very, very important, even at home.
Thank you, panelists. We now have time for the last two questions. Can we have Aradhana from Reuters to ask her question?
Thank you, ministers. I'm just looking for some data here. I was wondering if you can tell us what percentage of the confirmed cases in Singapore were asymptomatic when they were tested, and also what percentage of the confirmed cases in the dormitories were asymptomatic when they were tested?
Thank you very much for the question. Unfortunately, I don't have the data at this point in time to be able to give this to you. We hope as more information comes out, we'll be able to convey this to you in the media as well. Part of the reason why that's not easily available is because we're testing people and confirming cases across multiple settings. It takes time for us to bring that level of information together. We're testing across settings where people report to our medical posts with symptoms, but yet at the same time, we're also doing some level of active case surveillance, active case finding in some of the other dormitories where a number of these other individuals have either no symptoms or mild symptoms. So once we have that data, we will try to give that to you.
Thank you, DMS. Can we have Hee Ai from Wampao to ask your question, please?
Hi. So basically my question is about testing. So what is our capacity for, in terms of our tests, and how many tests have we done for foreign workers and also within the community itself? And just like P.B.B mentioned about us buying from other countries. So why is there a need to do so when we have our own capabilities already? Is it because supply is not we are not able to produce the test kits fast enough? Thank you.
Well, we are continuing to test, and we, in fact, have tested a lot more than what we used to at the early phase of this particular outbreak. To give you a sense of the numbers, we actually, just in the foreign worker setting alone, we've been testing anything between 1,005 to perhaps about 2,005. The number varies from day to day, in part also because on certain days, we ramp up testing in the dormitories, including active case finding. But in other settings, we in fact emphasize and prioritize testing for workers who continue to be, in fact, contributing to Singapore through the provision of essential services. And that testing is to assure us, not just those of us within the task force, but also the public, that the workers that are continuing to contribute are in fact not infected and they are not at risk of transmitting infection to other people in the community itself. So the number varies. We also test across other settings, as you know, for other people who may have infection or suspect cases in the community. And therefore, the number sometimes would rise as close to 2,008 or even 3,000 in a day. But the number would vary on a day-to-day basis. As you know, we have had a number of foreign workers who have had the infection, and already when we talk about the number of foreign worker confirmed cases, I don't have the figure for today, but as of yesterday, there was something in the order of about 5,100, that order of magnitude. So easily you could see that as a minimum, just in the dormitories alone, that's already the number of tests have been done. But we've done, in fact, more than that because there are also those that we've tested and tested negative as well. So the number continues to grow.
Let me just add the point that Minister Gan earlier mentioned, that we should not just be focusing on the testing. The testing is really part of a more holistic strategy to look at how we can use that to contain the spread of the virus, to treat those who are infected early so that we can reduce the complications from that, and to have the sentinel surveillance for us to be able to, as part of this broader prevention strategy. So we should not just be looking at the number, but really the overall approach to dealing with this. Josephine, you have...
I just wanted to emphasize that point from the perspective of a migrant worker. Whether or not you test me, what I really want is treatment. I want to be put on the path to recovery. So for all the medical support teams that are deployed to the purpose-built dorms and all those that are reaching out to all the migrant workers in the other dormitories, the mission is very clear. We are trying to identify all of the migrant workers who need our support. And whether or not we test them, as long as they present symptoms, what you really want to do is to be able to isolate them, and you want to be able to treat them. And I think the emphasis has to be on the isolation and, more importantly, the treatment. At the end of the day, for the migrant worker, it is the treatment and going back on the path of recovery. That is what matters most.
Can I just clarify that there was a question of why we are still buying more, and since we are able to produce ourselves? I think first we want to keep our options open. We want to be able to also use different models, different test kits, different ways of testing. And one of the important consideration we have to bear in mind is that our testing is not just for now. And for the moment, we are focusing on foreign workers in our dormitories, as well as our essential workers. But going forward, we need to think about, in the eventuality, in the end, when we want to lift up our circuit breaker measures, when we want to begin to open our economy, allow workers to go back to work, allow life to go back to normal, and as we progress in opening up our circuit breaker measures, we will need to increase our testing capability, because we need to make sure that there's no transmission in the community. And in order to make sure that there's no transmission in the community, we need to test a lot more. So therefore, one of the reasons why we need to ramp up our testing capability and capacity and options is to prepare for the eventuality that we want to plan for the opening of our circuit breaker measures. So I think it's for different purposes.
Thank you, panelists. Now we do have time for one final question from Janice from Business Times, please.
Hi, I would like to ask for more clarity on the move to tighten the list of essential services and cut commuter numbers, by which I mean, will you be removing entire categories of businesses from the list, or will it be something like only X% of supermarket branches can be open? So when can we have these details?
MTI will be putting this list out very shortly after this press conference. Essentially, as I said, across all sectors of the economy, we are looking to tighten the workforce who need to go out to work daily. We do not intend to cut back on supermarkets or wet markets. These ought to remain open because they provide essentials for Singaporeans and residents. The F&B outlets that are still open, there will be some tightening of that. Not all will remain open, so some will have to close. And for shops and businesses that are consumer-facing, we are likely to also tighten. Some may be suspended, some may be restricted in terms of their operations as well. All right, so that's the general picture, but the specific details, MTI will be putting out an update very soon.
Thank you. We have now come to the end of the live virtual press conference. Thank you, ministers and panelists, for your time today, and thank you everyone for attending today's press conference. Press materials will be disseminated shortly to our media participants. Video footage, photographs, and a sound feed will be emailed to you separately. Thank you and have a nice evening ahead.
And you were just listening to Singapore's multi-ministry task force giving an update via virtual conference on the COVID-19 situation. Well, Singapore's so-called circuit breaker period has been extended by about a month to the 1st of June. The continuation of the strict safe distancing measures was announced by the country's Prime Minister in a live televised address to the nation. Some existing measures will also be tightened, and these include closing more workplaces and keeping only the most essential services open, and entry restrictions at hotspots like wet markets to thin crowds out even more.
We have called on all Singaporeans to stay home. Go out only for essential needs, like buying food or groceries. Otherwise, please stay at home. if you do need to go out, then go by yourself, not as a group or as a family. Even when exercising outside, do so only by yourself and only in your own neighborhood. Remember, it's not just about adhering to the letter of the law. The spirit of the guidelines is to reduce movement to a minimum and to avoid being out and about in the community. This is the way to protect yourself, your family, and everyone else. So I hope everyone can cooperate and do your part. Some hotspots, like some popular wet markets, are still a problem. Large groups of people continue to gather at these places, making it hard to practice safe distancing. These places will impose entry restrictions to thin out the crowds even more. You can do your part too. Do your marketing on weekdays rather than weekends. And don't bring your whole family with you for grocery shopping. When you run errands, go out alone, get what you need, and return home straight away. We will also close more workplaces so that only the most essential services will remain open. This will reduce further the number of workers keeping essential services going and minimize the risks of transmission among the workers. It will mean some degradation of services. For example, less frequent grass cutting in our HDB estates. But I hope we all understand why this has to be done.
Mr. Lee added that the large number of cases in migrant worker dorms is a serious problem. To date, infections in such settings account for about 7,000 of Singapore's approximately 9,000 cases. Mr. Lee noted that almost all of the workers infected have only showed mild symptoms, even as healthcare personnel here work hard to take care of them.
We hope that the situation in the dorms will remain this way, most of the cases being mild and very few needing oxygen or intensive care. All the major dorms are supported by dedicated teams of doctors and nurses. To protect the health of our migrant workers, we will step up the medical resources in the dorms. We will deploy more medical personnel to make sure that anyone with fever or flu symptoms receives appropriate and timely medical treatment. We will house the mild cases either on-site in a separate facility within the dorm or in community care facilities elsewhere. And we will make sure that those who need more active treatment receive immediate attention and can be sent promptly to the hospital to help them recover. We will also pay special attention to the older workers who are more vulnerable. We are preemptively moving them to a separate dorm where they can be monitored more closely. To our migrant workers, let me emphasize again, we will care for you just like we care for Singaporeans. We thank you for your cooperation during this difficult period. We will look after your health, your welfare, and your livelihood. We will work with your employers to make sure that you get paid and that you can send money home. And we will help you stay in touch with friends and family. Ramadan begins in a few days' time. We will make sure that arrangements are made for our Muslim workers. When Eid al-Fitr comes next month, we will celebrate with our Muslim friends, just as we celebrated the Indian New Year with our Indian friends last week. This is our duty and responsibility to you and to your families.
Mr. Lee added that there are two other groups of migrant workers that the government is closely monitoring. One group lives outside of the dormitories, and the other comprises workers in essential services who are still working during the circuit breaker, who may move in and out of dorms, becoming potential channels of cross-infection. Well, Mr. Lee said the government is also testing them to make sure infections are picked up early. However, he said that the dorm clusters have remained largely contained so far and have not spread to the wider community. Singapore's Health Minister Gan Kim Yong says even though the weekly average of new cases in the community has gone down, the number of unlinked community cases is still worrying.
While we are addressing the cases in the dormitories, we are also monitoring closely the number of new cases in the community. The circuit breaker measures appear to have helped. The number of new cases in the community has decreased from an average of 39 cases per day in the week before to an average of 29 per day in the past week. That said, the number of cases in the community remains a worry for us. What is particularly concerning is that the number of unlinked cases in the community has not fallen, averaging about 20 cases a day. We have also been picking up COVID-19 cases from our surveillance programs. This indicates that there is continued seeding in the community.
Well, Singapore has reported 1,111 new COVID-19 cases, bringing the national total to 9,125. The Health Ministry says work permit holders residing in foreign worker dormitories make up the vast majority of the new cases. 20 cases are Singaporeans or permanent residents. An American commercial pilot accused of breaching his stay-home order while in Singapore is expected to plead guilty. Two Singaporeans also appeared in court today for similar offences after allegedly leaving their homes while on stay-home notices. Each offence carries a fine of up to $10,000 and a jail term of up to 6 months. 44-year-old U.S. citizen Brian Dugan Yergan faces one charge. He allegedly left Crowne Plaza Changi Airport to take a train to City Hall and walked to Chinatown Point to buy personal items. He is expected to plead guilty on Thursday. One of the Singaporeans, 47-year-old Chong Chun Wah, faces 3 charges. He's accused of leaving his Bukit Batok home on 3 occasions, twice to buy food and once to check his letterbox. The other Singaporean, 25-year-old Siti Wan Suaida, faces 2 charges. She allegedly left her Woodlands home to buy groceries and cigarettes, during which she did not respond to calls from the authorities. More than 62,000 employers will receive close to $675 million in the first wave of foreign worker levy rebate payouts from today. It's part of the Solidarity budget, giving employers a levy rebate of $750 for each work permit or S-Pass holder. Aimed at supporting employers during the circuit breaker period, the payouts are on top of the waiver of such levies for April. Now, the payouts will be disbursed to eligible employers who have paid at least 1 month of levy due this year. Employers need not apply for the rebate. They will be informed once the rebate is successfully paid. Those who have signed up for Pay Now Corporate will receive theirs today. Those who haven't can sign up by next Wednesday to get the rebate a day after that. The remaining employers will receive theirs via check from mid-May. Well, we're going to go for a short break now, but we will bring you more COVID-19 updates when we return.
It's a huge drop, and they look totally comfortable. Karl Anthony Towns said, "Why don't you help me look good on the court, and I'll help you blow up in the NBA."
When they asked me when I was a little kid, "Oh, what do you want to be when you grow up?"
Time to try it.
Value of their data.
So it'll really. This kind of.
Five-hour energy. Give it your best shot. Discover how the digital era is changing engineering, from securing,
Technology enables us to quickly respond to the needs of the public.
innovating,
We desire to explore new possibilities that were not achievable before.
and thriving.
The digital age opens a platform for tremendous opportunities.
Learn about modern engineering on A Class Above, Friday on CNA. This is brought to you by the following company.
The Huawei P40 Series 5G. Break the boundaries of speed and distance. Capture the best part of every moment. Even at night, you can discover stories within stories. Huawei P40 Series. Visionary photography.
Hello, Singapore. How's everyone doing? All staying at home and trying your best to fight COVID-19? But stay home and do what? Well, I'm staying home and staying in shape. Not quite there yet, but I'll get there. Let's see what our friends are doing at home.
Michelle is putting her baking skills to good use. So sweet of her in these trying times. As for Daryl Ann, she's having a blast with her dad at home. Kermit is giving his wife a well-deserved break. And Vanetta is showing others how to make homemade masks.
Mask done.
So, what have you been doing? Singapore wants to know. Join the Stay Home for SG challenge. Share your photos and videos with us, and you could win $300.
Its centuries-old history gives us an understanding of where China's future lies. I have a front row seat as China's new chapter unfolds, and I'm not about to miss this moment in history.
Olivia Xiong, CNA, Beijing.
Welcome back to Asia Now. Singapore's so-called circuit breaker period has been extended by about a month to the 1st of June. The continuation of the strict safe distancing measures was announced by Prime Minister Lee Hsien Loong in a live televised address to the nation. And our reporter Cheryl Goh joins us right now. So, Cheryl, we know that the circuit breaker measures have been tightened. So tell us, what can people in Singapore expect in the coming days and weeks in terms of what they can or cannot do?
Well, I'll tell you, going solo is really the name of the game, as the circuit breaker has been extended to June. So this task force has said that if you really need to leave your house to buy essentials or perhaps to do some exercise, you now have to do this alone and not to make it a family outing. This is really because unlinked cases in the community have gone down, but not fast enough. Another notable update from the task force today was that there will be now staggered entry to selected wet markets, especially those that are more popular, that see bigger crowds, and this will be based on your IC number. And also, yeah, that's about the main updates for now.
Now, in terms of the foreign worker dormitory, what are some of the latest updates on the situation?
Well, the task force updated that containment and testing efforts in the dorm will continue, but they did say that 10,000 essential workers in these dorms have been transferred out, and they are now living in separate living spaces. There is also another update that all workers in the dorms are to stop going to work. And this new condition applies to workers from all companies, including those that had been exempted previously. So MTI, the Ministry of Trade and Trade and Industry, will inform these companies that now have to stop operations. In terms of the transmission, Mrs. Teo, our Manpower Minister, she updated that based on the contact tracing, they have been detecting transmission at common work sites, but also other places where the dorm workers tend to socialize and gather. So there really is a need to, contain this and continue with the isolation and tracing efforts. Back to you, Atali.
All right. Thanks very much, Cheryl Goh, there with the latest on Singapore's latest measures on the COVID-19 pandemic.